Welcome to our deep dive into one of the most pressing public health concerns of our time, that is dengue fevers.
Imagine a disease which turn a simple mosquito bite threatening condition among human beings, which impacts 100 million people per year.
WHO listed dengue as a potential threat among 10 diseases for 2019, and current outbreaks in many countries confirms this observation.
The World Health Organization has classified dengue as a priority due to its epidemic potential and the severe burden it places on health systems.
What is dengue fever? Dengue is an outbreak-prone, seasonal, viral disease transmitted through bites of female adult Aedes mosquitoes.
There are mainly two dengue mosquito species, namely Aedes aegypti, Aedes albopictus.
Let us discuss about the symptoms of dengue fever. The symptoms start appearing 4 to 10 days after a bite of mosquito and last for 3 to 7 days. The symptoms are: first one, high fever, headache, pain behind the eyes, muscle or joint pain, and rash on the body. Most people recover within a week or so. In some cases, symptoms worsen and become life-threatening. This is also called severe dengue or dengue hemorrhagic fever. Now we move on to the causes of dengue fever. Dengue fever is caused by the dengue virus. You can't get dengue fever from being around an infected person. Instead, dengue fever is spread through mosquito bites. When a mosquito bites a person infected with a dengue virus, the virus enters the mosquito. Then, when the infected mosquito bites another person, the virus enters that person's bloodstream and causes an infection. Now, we move on to the diagnosis of dengue fever. Dengue fever is diagnosed with the help of blood test. Your healthcare provider will send a sample of your blood through the veins, and they will send to the laboratory to look for the signs of dengue virus. Now we move on to the management and treatment for dengue fever. Actually, there is no medicine that treats the dengue fever. Only there is a symptomatic treatment is available. Means depending on your symptoms, what you have, the doctor is going to provide the medicines. Means if you have the fever, if you have the headache, body pain, and rashes on your skin, depending on that type of symptoms, the doctor is going to give you the particular medicines. But actually speaking, there is no medicine present till today for the treatment of dengue fever. Management of dengue fever. First point, keeping yourself hydrated by drinking plenty of water and fluids. Getting as much rest as possible. Treating pain with prescribed medicines, because there is no proper medicine to treat dengue completely. That's why you need to manage your symptoms in a proper way.
Let's have a discussion over preventive measures of dengue fever. The World Health Organization stresses that the vaccine is not an effective tool on its own to reduce dengue fever in areas where the illness is common. Preventing mosquito bites and controlling the mosquito population are still the main methods for preventing the spread of dengue fever.
Now, I'm going to discuss with you a few preventive measures to avoid mosquito bites. In that, the first one is always wear long-sleeved shirts or dress, long pants, socks, and shoes. And the second one is during the sleeping, you should use the mosquito nets. Third one, use EPA, that is Environmental Protection Agency, registered insect repellents that contain 20% to 30% DEET or ingredients known to help keep Aedes mosquitoes away. Next one is remove standing water like buckets, barrels, bird baths, old tires, coconut shells that may hold rainwater. Avoid traveling to areas where dengue is common. Next one, disposing and destroying all unused containers, junk materials, tires, coconut shell, etc. that you need to dispose and destroy. Otherwise, they are the places where the dengue mosquito breeds. Next one, covering all water holding containers and tanks with tight lids. If you keep open, that are the places where the dengue mosquito are going to breed.
Yeah, there are some curious queries, FAQs over dengue fever. Then let's get answer from the sir who is going to clarify FAQs questions. Please, I welcome sir. Welcome sir.
Okay, thank you, sir.
Sir, just I would like to ask us some questions in the form of FAQ. First question, why do platelets decreases in dengue fever?
Okay, that is interesting question, sir. In dengue fever, you observe that the number of platelets decreases drastically because of the main reason, the dengue virus, which will affect our body, it will suppress the bone marrow, and that leading to the decrease of platelets. And do you know the bone marrow site where the platelets and all other cells are produced, and mainly that affect the bone marrow functions. So that's why in dengue fever, the number of platelets decreases drastically.
Yes, sir, thank you. Sir, let's move on to second question. How does the Aedes mosquito look like?
Okay, that is interesting one again, because generally all mosquito, they will not carry the dengue virus. There are certain characteristic features. Let me explain you so that you can identify which one is dengue virus carrying mosquito. Generally, the dengue mosquito are small and blackish in color, and there are presence of white stripes on abdomen and legs. And these mosquito we call the tiger mosquito, sir.
Wow, tiger mosquitoes.
Yes.
Sir, one more question which is hitting my head, sir. And question goes like this: does Aedes aegypti mosquito breed in dirty, polluted water and drains?
Yes, another curious question, sir. Let me clarify. The dengue mosquito, it will not breed in dirty water like drains and any dirty water. It will breed in clean water. Do you believe, sir?
No, sir.
Especially in stagnant water. I'll give certain examples where the clean water stagnates for a week. Even if 1 week the clean water is standing, means there the Aedes mosquito will breed. Especially in your overhead tanks, underground tanks, and any discarded containers, water bottles, coconut shells. Even during rainy season, rain will collect in that empty bottles, empty coconut shells.
Wow.
So that is clean water only, rainwater is. And in that, if 1 week if you leave like that only, if you not discard that all unwanted things around your house, in that clean water, the dengue mosquito start breeding, and that is the site where the dengue mosquito will breed and enter your house. And even especially in your homes, you are keeping the bamboo tree.
Wow.
For decoration purpose or any other purpose, you're keeping the bamboo tree, and even the money plant bottles.
Wow.
In that, the water stagnates for a week. So they are the places where the dengue mosquito start breeding, not in dirty water. Remember this point.
Sir, really curious point, sir. Curious, sir. Sir, here is another question. How long eggs of Aedes takes to become adult mosquito?
Yes, sir. See, dengue vector generally takes about 1 week to become adult from egg.
Oh. Sir, let's move to next question. What is the average lifespan of an adult mosquito?
Okay. The lifespan of average adult mosquito is around 3 weeks.
3 weeks. Sir.
Yes, sir, 3 weeks.
Sir, next question. Where does dengue vector rest?
Okay, this is also very interesting question, sir, because you need to understand where the dengue mosquito rests. Especially in our indoor houses, dengue mosquito rest under your furnitures, under shelves, and even under beds, and where in your rooms the clothes are hanging in the dark areas. There also dengue mosquito will rest.
Yes, sir. Nice, sir. Interesting. Sir, I am at a dilemma, sir. Does this mosquito bites all the day, all over the day?
Yeah, another interesting question, sir. Because the dengue mosquito, they will bite all over the day, but especially during in the morning hours they will bite a lot, and the time also they will give, especially between the morning 8 a.m. to 10 p.m. they will bite a lot.
8 to 10, sir.
Yes, sir. In the morning hours, and even in the afternoon hours, especially between 3 p.m. to 5 p.m. also they will bite a lot.
Wow, it is amazing, fascinating fact, sir.
Yes, sir. Even night also they will bite, but rarely they will bite at night. But be careful in the daytime. That is especially morning 8 to till evening 5, because this is the most convenient time to bite the mosquito. That is dengue mosquito. That's why to follow the precautions even during daytime also. Whenever sleeping, especially during daytime, you need to use the mosquito net to save from the dengue mosquito. Don't consider that dengue mosquito will bite during night when you're sleeping. No, especially they will bite morning 8 a.m. to 8 a.m. to 10 a.m. and afternoon 3 p.m. to 5 p.m.
So fascinating, sir. This is fascinating point, sir.
Yeah.
Sir, another last interesting question, sir.
Yes, sir. Yes, sir.
Is there any scientific method where we can reduce the percentage of Aedes mosquito?
Yes, sir. Current experimental, I will tell what is going on. So currently in this environment there are genetically modified mosquitoes. Scientists created the genetically modified mosquitoes. Let me explain you what I mean by genetically modified mosquitoes.
Those are special ones, sir.
Yes, sir, there are special ones.
Okay.
So scientists developed sterile male mosquitoes, and they are released into the atmosphere, and that sterile mosquito will mate with the adult females, and that female produces sterile eggs. So still it is under the experimental stage, still research has to be done. So we can consider still it is in the experimental stage only.
Yeah, fantastic, sir. As you have given marvelous information about this mosquito, sir.
Yes, sir.
And this is really beneficial to us, sir.
Yes, sir.
Dear friends, in case if you have any queries, please ask and write your questions in the comment box and ask to sir also. Sir, thank you very much for providing priceless information.
Thank you, sir. Thank you very much. And any FAQs left over by us, you can comment in the comment box. So we'll try to give the answers. I hope this video makes you the most important one and most informative. So I hope you got the few informative knowledge about the dengue fever. Thank you, one liner.
Thank you very much.